And the first question I want to take is the one that almost made me shock this morning after my call. If you had a cesarean section in your first pregnancy and you want to have cesarean section again, are they going to cut you from the same spot? I hope the question is clear. So let me answer this question. When you have your first cesarean section, you are getting an external cut and an internal cut. So the cut you are seeing on your tummy, thank you. The cut you are seeing on your tummy is not the only cut that you had during cesarean section. So apart from the cut you are seeing on your skin that has healed, you have several other cuts inside. So they cut your fat layer, they move and meet your muscle. For most professionals, for most surgeons, they will just either separate your muscle like this or separate it like this. So they are not going to cut it. Like I said, for most surgeons, for small percentage of surgeons, they may cut your muscle, but it's not the recent practice. The recent practice is to separate the muscle, except maybe a repeated cesarean section and there is adhesion. You know, there are scar tissues that they need to pass through and it's not separated, so they can cut to find their way in. After the muscle, you have the peritoneal cavity, like, let's go off these medical terms. So when they cut, finally they are going to get into your womb. So when they get to your womb is going to be intact, you know, and then they're going to make what we call a lower segment cut on your womb, on your uterus or your womb, the same thing, okay? This cut is what you should be, like, that's what should be disturbing you. Because there can be a lower segment cut, yes, anatomy time. There can be a lower segment cut on your womb, or a vertical cut that we call a classical cut. So, when you're having another cesarean section and you come to me and say, doctor, I had a cesarean section in 2021 and I am ready to take it now. Can I achieve a vaginal birth? If I analyze things that led to your cesarean section, and there are things like you had a big baby, you had a placenta problem, and there are not things that I am expecting to occur again. After that, I'm not going to tell you to go and have another cesarean section. What I'm going to ask you is, do you know the kind of cut that was given to you on your womb? Not the one you are seeing on your skin. I'm going to still come to that skin issue that is bothering them in the community. But this is the important thing. The cut on your womb is more important than the cut you are seeing on your skin. The cut on your skin is nothing. It's going to heal and turn to a skin. But the cut on your womb would decide if you will ever go back to a cesarean section, or whether you are going to attempt a vaginal birth at all. So, when you have a cesarean section in the hospital and when they discharge you, just carry your bag and go home. It's not right. You have to ask your surgeon, what kind of incision did I receive on my womb? Yeah. What kind of incision did I receive on my womb? Was it a lower segment or a classical incision? Because if you receive a classical incision, maybe you had a fibroid that was blocking the lower segments and they did a classical incision, or maybe you had a ruptured womb, or for something, anything, any reason that made them to give you a classical incision, you are not going to be allowed to go for vaginal birth, even if you qualify for it with other factors. Even if you tick off other factors, but the scar that you have on your womb is a classical incision, you can't go for a cesarean section, because when your womb is contracting, the bulk of the contraction is at the top of your womb. And that is where the incision for classical incision extends to. So what do you get? You rupture your womb. So your risk of having a rupture after a classical incision is almost 95%, and you can die from it. without even having, and you don't want to even begin with that. You know, last year I shared that a doctor in the United Kingdom in Nigeria reached out to me. Please, she wasn't trying to shade Nigeria because she never had opportunities to school in Nigeria or work anywhere in Nigeria. She was bred there, school there, because I know her personally, we're from the same town. Bred there, school there, and she's working there. So she saw the carousel I made about vaginal birth after cesarean section, criteria and on, and she was like, no, I think women can try after this is and I understood her point of view. But I had to let her know the situation of things that we have in Nigeria. Let's say, for instance, you had a ruptured womb at, let me use Lagos, for instance. You live in Ikeja. Ikeja is even central. Let me not use Ikeja. You live in Ikorodu or Badagry, or let me even use Festac. And your hospital is maybe in Ikorodu or Festac, but you know that we have shortage of surgeons in Nigeria. Like one of my clients that delivered in Agor, the surgeon that did her surgery came from the island. And I'm not going to lie, when I had my surgery, my surgeon came from Island Maternity to the private hospital I was using where I live. You know, and it took the surgeon 3 hours to get to my location. It was an elective surgery. Imagine if you had a rupture, you had a classical incision, and you are trying to labor to know if it's going to work, and you rupture your wound, and the surgeon that is going to rescue you is on the island. What are we going to trend on Facebook? Hey, yeah. You're going to join the statistics for maternal deaths. So this is why in Africa, we don't practice global medicine in Africa. You practice what is obtainable in Africa. When it comes to Africa, you practice what is obtainable in Nigeria or wherever you are. Okay? So if you have a classical incision, no. If you have a lower segment incision, your womb is like this, they give you lower, yes. If whatever caused the previous surgery is not something that is going to is not something that is going to recur. But if it is something that is permanent, something like you have a small pelvic bone. See, even lizard will not pass there, so don't tempt yourself. If you have a small pelvis, like they examined you, and you have your pelvic structure is very small, the baby will not pass. So even if you give birth to 10 babies, they will not pass. But if your pelvic is adequate, but the baby you are currently having, or you had, was above 3.5 kg to 4-5 kg, and the baby is bigger than even though you have like moderately adequate pelvis, and the baby is bigger, when you have another baby that is around 3 kg, 2.5, 2.8, you can go and attempt vaginal birth, okay? But you have to meet other criteria, okay? Like the waiting time, the 24 months waiting time, making sure that you don't have every other contraindication. I've written this on a carousel, and I'll look for it and repost it again. So let me get back to answering this question. Now that I've cleared the type of scars that we have during cesarean section, let's talk about the physical scar that you are seeing, the one that was bothering this woman that made her to come to our community to ask about it. But before I answer this question, let me read some of the response she got in the community. So, someone told her that when you are going for cesarean section, this is your tummy. This is your tummy, right? It's round. They can do an incision like this. This is a vertical incision. It can run from below your umbilicus, your belly button, down to lower part of your pelvic. Or you can have, this is your tummy, you can have an incision that runs like this. You know, fenestrial incision. This particular incision is given to you on your pants line. Why it's given on your pants line is because this cesarean section originated from the West, and because Western women do summer body, they want to go under the sun, they wear their bikini, so we call it bikini line incision. So that when a woman has a cesarean section with this fenestrial incision, with this bikini line incision, they are going to be able to use their bikini to cover it. So when they go for their summer body, nobody will see the scar because it's covered by their bikini line. And this is the commonest incision cut that you're going to get as a woman during cesarean section. Okay, so this woman is asking if she has had this incision and she wants to have a cesarean section again, would the surgeon that is would the heartless surgeon cut through this incision again, or they are going to give her incision from another place? So some people told her that, a woman actually told her that when they want to give you incision as the first time, this is very funny because people that read anatomy here will know why I am laughing. So this is the anatomy. The woman said when they want to give you incision, they start in this center and they can go either left or right. So during your first incision, they will go left, and during the second one, they will go right. Please, this is not true. Okay, there is nothing like this. You're not doing appendectomy. This is not appendix surgery. Okay, please. So the bikini line incision they're going to get during cesarean section is depending on the surgeon and your body. Okay, for some people, you see them, their incision is just like C curve, like it's just small. It's not even up to 5 fingers, because maybe the baby is small, the surgeon is well experienced and well skilled, and he doesn't want a lot of space. So the space he had was enough for him to deliver your baby. For some other people, you have a longer C curved incision cut because maybe your baby is bigger, and when they gave you the small one, the surgeon put his hand and he's not having enough space, to remove the baby or to see what he's doing. And for us in the theater, what matters to us is your safety and that of your baby. Your safety first and then the baby. So if the incision is going to be widened, for us to see very well, they are going to widen the incision. That's why you see some scar. They are C small or C bigger. They can be up to half a circle. Depending on the skill of the surgeon, the condition of your tummy, the amount of body fat you have, the size of your baby, and some other factors that maybe they saw a bleeding vessel and they just wanted to arrest it and they needed space to arrest it. Please, that should not matter to you, because everything they were doing inside there was to keep you safe. Now, for some people, if the surgeon is suspecting that he may not have enough exposition to do what he's going to do clearly, they can give you a straight incision from under your belly button down so that they can see properly. For some people, in rare occasion, you may see the vertical incision, the straight line, and some form of C incision. All these things is for the surgeon to see kolo, so you now have mistakes depending on situation or the condition that they encountered during the surgery. This is about skin incision. It's different from the incision I explained that will be given to you on your womb. And like I said, the incision on your womb is what matters to us, not this skin one. This skin one is nothing. If you had an accident and you break your leg, isn't it the skin is going to close now? So cesarean section is not different from that. Okay, so when we are telling you to wait before you conceive, we are not saying that the incision on your skin has not healed. We are talking about the estimated time for the incision on your womb to heal, not the incision on your skin. And yes, if you are going to have another cesarean section, the surgeon is going to cut, if all condition is met and there is no changes, the surgeon is going to cut on or just below or a little above the previous incision. Let me repeat. If you are going to have another cesarean section, for instance, I had a cesarean section. If I'm going to have another cesarean section, because my scar is not too smooth, the surgeon would not want to go directly on top of it. So if this was the previous scar, he will either go below, just some inch below, or just a little above. But when he's going to repair it, like we do where I worked before, he's going to, for instance, if you had a very rough first healing, like keloid or hyper scar, what they call it again? Sorry, my head is jamming. Okay, like you have scar tissues formed there and it's not smooth. A lot of us will have it. During stitching, when they have delivered your baby, they're now going to cut out the scar tissue, the rough of the old one, and now extend the skin of the new one to use it to cover it to be smoother. So this means that your next cesarean section, the cut can be on top of the old scar directly, or just above it, or just below it. But when they are suturing it, they may want to trim out the rough old scar to give you a finer outlook. And like I said, it's nothing. It's nothing. You're not even going to feel it. In fact, I've seen a woman that had one of the worst scars I've ever seen in this life. And when she came for her second cesarean section where I worked, we did a fantastic plastic surgery for her. And when she healed the second time, you will barely see where the scar was. So the scar on your skin is not even painful now when it's fully healed. So when they are cutting on it the next time, you are under anesthesia, you just feel like another scar, another cut on your skin. Okay? Then when they go into your womb, they are going to also cut on the previous old scar, because every scar on your womb weakens your womb. Every scar weakens your womb and can expose you to rupture even before you enter full surgery, full labor in your next pregnancy. So they want to maintain a particular weak point. This is also the same for women that are having episiotomy. Somebody cannot come and give you episiotomy here today, and then you come back again and there is need for an episiotomy, and then they will not go above that one and give you another episiotomy on it. It's not the ideal practice. If the first episiotomy was given at the right spot, the next midwife or doctor should be able to give you episiotomy on top of the old scar so that you can maintain a particular weak point. You don't want, because imagine if they tear you this side, they tore here, next one they tore here, they tore here, then you come back again and the whole 3 weaknesses open up at the same time. God forbid. Disaster. It's going to be a disaster. So it's best to have incision on top of the old incision to create just one weakness on your skin, on the womb, or whether it's an episiotomy. It's the same thing. Maintain one particular weakness when it is possible. Okay? I hope this question is sorted. Let me get another question that they asked.